Hello, my name is Michelle Barakat-Johnson. I work as the Skin Integrity Lead at a local health district in Sydney, Australia. Our local health district has 4 hospitals and 5 community health centres. And I would like to thank Monica for inviting me to present this webinar series about a subject that we've all faced, that's COVID-19. I particularly have a special interest in COVID-19 because we admitted a number of patients who had COVID-19 and were prone. This is the second webinar in a series of 3 webinars. In the first webinar, we looked at the risk of pressure injuries in prone patients and what we have learnt during the COVID-19 pandemic. In this webinar, we'll highlight best practice in pressure injury prevention and how prophylactic dressings can help in prone position patients. And the third webinar will focus on clinical practice change and how we actually adopt best practice with reference to pressure injury prevention in prone position patients. So just to recap on webinar 1 and what we covered, we talked about that ever increasing in numbers of patients presenting with acute respiratory distress syndrome, and it's been recommended by critical care practice guidelines and governing bodies to prone patients. We treated prone patients in a COVID ARDS prone position because it improves ventilation and oxygenation. We looked at being in a prone position for extended periods and how that's actually associated with pressure injuries. It's really important that prior to proning a patient, we take into consideration our support surfaces for the patient and other type of pressure injury prevention techniques. Because the patient's in a prone position for a number of hours and it's really hard to reposition them, prophylactic dressings are an important consideration. So today we'll cover prophylactic dressings and how they're a widely accepted intervention in reducing the occurrence of pressure injuries in patients who are at high risk of developing a pressure injury, especially those in a prone position. We also want to highlight that not all dressings are specifically designed to prevent pressure injuries. I also want to emphasise the importance of using dressings that are supported by robust scientific clinical evidence. And I want to run through what we developed in our district and the benefits of having dressing packs. So prophylactic dressings, well, they've become a widely accepted adjunct method of preventing the development of pressure injuries in patients considered to be at high risk of developing a pressure injury. The types of prophylactic dressings available include soft silicone foam, multi-layer dressings to redistribute the pressure and shear, such as Meplex border that you see there on the slide. There's also a Leave and Life and polyurethane dressings such as Opsite, Flexi Fit, hydrocolloid dressings such as Duoderm, extra thin to alleviate shear and friction. Prophylactic dressings are usually applied over bony prominences and where appropriate under medical devices. However, selection of the type of prophylactic dressing should take into consideration a number of factors, and these include dressings that have been proven to reduce pressure injury occurrence in rigorous studies. The anatomical location and the shape of dressing, the layers of the dressing, and if placed under medical device, should all be taken into consideration. And it's really important that the dressing we place under the medical device does not interfere with the actual device itself. And another thing here is that the dressing can actually absorb moisture, so it's got that moisture management and microclimate management. So how do prophylactic dressings work, and why do we choose prophylactic dressings? Well, with public health emergencies such as the COVID-19 pandemic, it really creates that urgent need to prevent negative outcomes such as pressure injuries. And we know that pressure injuries are a quality indicator for care of patients. So when we're looking at preventing negative outcomes, in doing so, we really want to use resources and materials that are currently available and techniques we already know work, especially when we're in a mid. Therefore, the use of these dressings in a prone position is an important consideration. However, to date, there remains little published data available with clinical evidence for the prevention of pressure injuries in prone position. But perhaps the most studied dressing with the strongest evidence in the prevention of pressure injuries in critically ill patients is the Meplex multi-layer soft silicone dressing. Meplex has laboratory computer modelling, which has shown that these dressings reduce friction, shear and pressure. And the most recent computer modelling of Meplex BorderFlex has demonstrated a reduction in high-risk stresses by up to 70 to 80% in soft tissues over the iliac crest when exposed to multi-directional forces due to the flex component of the dressing that allows movement in all directions. A recent study published by one of our colleagues demonstrated that Meplex BorderFlex alleviated soft tissue loads at the sites when the head is in a prone position. So we looked at what it showed is that the dressings actually relieved it more than 50% when you compare the pressure that's placed on the head in a prone position without any dressings. When we look at the use of dressings in the prevention of pressure injuries in a prone position, much of the research has predominantly focused on patients in a supine position, with evidence detailed to a number of studies that did not investigate the use of dressings in a prone position. However, there are 2 studies that suggest that soft silicone foam multi-layered prophylactic dressings, such as the Meplex Border, demonstrated adjunctive efficacy in the prevention of pressure injuries on areas such as the chest and also the iliac crest. A well-known trial known as the BOSS trial, where Meplex Border was compared to off-site FlexiFix in a prone lying patients in theatre, there was a marked difference between the Meplex Border group and the off-site FlexiFix, with significantly less pressure injuries in the Meplex Border group. So in terms of our evidence, well, as I mentioned before, there's a lot of evidence, a lot of strong evidence that really focuses on pressure injury prevention when a patient's in a supine position. And Nick Santamaria has conducted a number of randomised control trials in the intensive care setting that have really demonstrated effectiveness in pressure injury reduction. The recent Border Trial 3 had potential advantages testing the effectiveness of dressings on residential aged care individuals who were mostly incontinent of urine and faeces. And the reason why I mention it here, and when we're looking at prone patients, is because the dressing has the ability to wick moisture, and that's really integral to allow perspiration to evaporate and not remain on the skin. And I know a number of our patients that came into the ICU, they were quite cellulitic, and having them in a prone position, there's a lot of moisture due to perspiration. So it's a really important consideration in prone patients. Other types of silicone dressings have not as yet had a number of rigorous studies to show their effectiveness in the prevention of pressure injuries, particularly in critically ill patients. A recent pragmatic trial of 393 elderly patients with hip fractures demonstrated that a leave in life resulted in a reduction of sacral pressure injuries. In addition, there's been a quality improvement publication where they've used a leave in life to reduce the onset of pressure injuries. For example, Salmon and his colleagues identified that the use of a leave in life as part of the pressure injury program helped reduce the onset of sacral pressure injuries by 40%. So for our patients, we developed a protocol application for prophylactic dressings to be used on all patients who were proned. We used the Meplex border flex for our COVID-19 critically ill patients. For ease of clinical use and clinical practice, we actually put together these dedicated packs of dressings, and one of our clinical nurse educators are holding those packs up. And we made these packs for each prone positioning event. The packs included quick instructions in dot points on how and where to apply the dressings, and a picture showing anatomical placement of the dressings. We started out by drawing silhouette of the body, and we marked areas of high pressure in a prone position, and we were actually guided by the National Pressure Injury Panel guideline that was actually released in April sometime after COVID hit. And in that guideline, they had a number of suggestions around pressure injury prevention for patients in a prone position. We were also mindful that a number of our patients had medical devices, so when you put them in a prone position, that medical device can either be dislodged or it could also cause pressure. So we were mindful of that. We worked out what size and shape of the dressing by testing it on ourselves. So we actually peeled the dressings off. We put some on our forehead and on our chin, and we lied down on one of the beds in ICU that were free. And we amended the sizes of the Meplex border based on the size of the area and its ability to mould and cover the area, and of course for comfort. So we really kind of tested this a couple of times. We also discussed this with the product manager, who was very helpful. We discussed this at length with the intensivist, because we also wanted to make sure that the dressings didn't actually impact on any of the other treatment for patients in a prone position. The intensivist was very supportive and felt that the packs were very, very helpful, very convenient. And after a number of iterations and consults with nurse educators in the intensive care and the intensivists, we then finalised the diagram with the help of our strategic relations and communications. And you can see the diagram up there. That is a diagram that's included in the packs. They went off to print. We ordered the stock that we needed, and when we received the pack, for each proning pack, when we received the print, we actually put them in each proning pack. These packs were initially packed by myself and the skin integrity wound care consultant, but as the numbers grew higher, we actually moved into getting some admin support, which was very helpful. We used large size sandwich plastic bags, and we labelled each dressing with the location of the body. We labelled the dedicated packs of dressings, and we called them prone pressure injury relief pack. Because they were packed compactly, they were then able to be stored in the ICU room, rather than having these boxes of different types of dressing shapes and sizes and expecting the clinician to go into the storeroom and selecting the ones they need. And we don't actually have time for that. So having these prone pressure relief packs were really, really convenient. We received a lot of positive feedback. So when a patient required them, they were easily accessible to all staff and clearly labelled. When the staff were low in stock, they would then call the skin integrity nurse consultant, and we made more up. We still have a number of packs left over. The packs were well communicated with the intensive care team via emails. All the staff were educated, and they were educated by the nurse educator when a patient was turned into a prone position. It was really hard to conduct education sessions amid a pandemic. So we found the opportunity when a patient was turned into a prone position, because usually we would need about 6 clinicians to actually help with that prone manoeuvre. This is one of our patients, and with his consent, he's allowed us to use these photos of him. He had COVID-19 acute respiratory distress syndrome, and was obviously cared for in a prone position. And with a team of 5 nurses and 1 doctor, we took a collaborative approach in identifying any pressure injuries on him before we conducted that prone manoeuvre. When we looked at the areas of the body, we really focused on the knees, the elbows, the hips, the clavicle, the sternum, the chin and the forehead. And we applied the Meplex border to all of these areas. We monitored the skin, of course, and it's really hard when you've got someone in a prone position to peel back the dressings every 2 or 3 hours. That just wasn't going to happen. But what we did is we peeled back the dressings daily, and we performed those micro shifts, micro movements, hourly, lifting the knees and the feet and the shoulders if possible. And this actually proved to be quite successful, because none of our patients acquired pressure injuries in a 12-hour period whilst in a prone position. We did have patients who developed pressure injuries from medical devices, and again, we're still working towards the best possible solution for pressure injury prevention in that area. And so, that was only 2 pressure injuries that were observed in the 3-month period around the medical devices. It became quite evident that the integration of the Proning Pack initiative assisted in ensuring the patient's skin was protected, and we do believe that further studies are critically needed in this area to determine the effectiveness of prophylactic dressings in patients who are in a prone position, and looking at dressing types, their application in preventing pressure injuries when patients are in a prone position. I'd just like to acknowledge a number of colleagues who we collaborated with when we developed these proning packs, and we've published on our proning packs and the effectiveness of those and how we went about putting the proning packs to get together. So in terms of some key important points to take home, it's really important to take on board that we know that not all dressings are specifically designed to help pressure injury prevention, and it's really important that there's robust scientific evidence behind that, that they work in pressure injury prevention. And also when we're looking at the critically ill and the intensive care setting, that's a different setting to a number of other settings. So also really important to be mindful of the patients in that setting and ensure that it doesn't clash with any other treatment strategies. For ease of application, and certainly for our district, we found it very, very useful to have these dedicated packs of dressings that were made up before the proning event, and that were easy accessible, that were well labelled, and just convenient for clinicians to be able to get hold of and apply on a patient. Thank you.